Hello, everybody. My name is Mary Morrissey. I'm psychology lead with the HSE Research and Evidence, and I'm principal psychologist in Connolly Hospital. I'm delighted to talk with you about the impact of COVID-19 on healthcare workers. I'm going to cover something about the research evidence, the causes and factors which reduce stress, a service I provided to public health in the East, some learning points from surveys, and then some pointers about future delivery. So first of all, it might be good for us just to have a reflection question. And if I could ask you all, how has COVID-19 had an impact on you? Has it been increased stress, disrupted sleep, improved focus, closer relationships, strained relationships? Maybe it's affected your finances. Maybe it hasn't had any impact on you. Or maybe there's something else that we haven't covered there. What I found from my own experience of working, providing psychological support, is that actually all of us have quite an individual experience of COVID-19. What the research has found and is finding is that although most healthcare workers are resilient and cope with the stressful, challenging experience faced during COVID-19 over time, that some people do develop depression, post-traumatic stress disorders, and anxiety. And obviously, that we are in an extraordinary circumstance, and that in a sense that our reactions are normal to extraordinary circumstance. In the research, sometimes people have spoken about the risk of moral injury. This has particularly been strong in the UK. And this is really the profound psychological distress which results from actions, or lack of them, which violate one's moral or ethical code. And we will have heard of maybe for people where there was a shortage of ventilators, where people were found, healthcare workers were found to have to choose between a patient to save as a priority, and how that would impact on and create a moral injury. What the research has been finding is that what works is psychological first aid. There's lots of studies on this, and what it involves is the providing practical supports, making sure that people have all the basic needs addressed, resources in terms of kind of mindfulness and support on stress, and also where somebody needs to be referred on and is having mental health challenges, that availability is there. Mindfulness has also been found to be a good practice when supporting people to cope, foster resilience, reduce burnout, and reduce the risk of developing mental health difficulties. And I'll talk a bit more about that. So what causes stress for healthcare workers? What has been the big sources of it for people? One area has been actually remaining in role while others were redeployed. On the Friday the 13th of March, there was quite an amount of people who were redeployed. It happened to me myself in being redeployed. And then for people who were remained in their work, then they had additional pressures. Being asked to work from home, while for some people it is fine, for others it is an extra burden, as we know, and does create some isolation. I think a very common theme for everybody, a source of stress, is actually having increased new responsibilities and increased workloads. It certainly seemed to be evident for many people working that this is a huge issue. Obviously, losing a colleague or a service user to COVID is huge stress and causing great sadness. Working with at-risk groups in nursing homes, homeless services, travelling community and direct provision have also been challenging for healthcare workers. And then working in high pressure acute and community settings under changed working conditions have all contributed to to stress. Factors which help to reduce stress obviously do include better staff training and education. I mean, none of us expected this in a sense. Okay, we saw what was happening in Italy and in China, and yet being able to provide staff training on either psychological first aid, reducing stress, or else for some people it was actually having staff training on areas that they hadn't worked previously. Stronger perceptions of organisation support. This is a key area for staff, feeling that yes, the organisation is behind us and also really with us. But this was kind of key to helping people feeling that they're not managing this on their own. Peer support and clear communication. It's been interesting that recent discussions about resilience is saying that resilience is more than within the person. It's actually built up between the bonds between people. So in that sense, it's really core and key that we have support from each other and that there is clear lines of communication. For those who had to work very, very long extra hours, it is important that the compensation for extra and provision of appropriate clothing is basic. I thought this was really interesting about the psychological response phases to COVID. And I'm sure many of you can identify this with this as I can myself. So in the beginning, we heard again what was happening from other countries, and it did create an anticipatory anxiety. Was this going to happen in Ireland? Could we flatten the curve? Then we kind of got into the active phase where a lot of people were characterized by heroics, the surge to solution, and people, I found that healthcare workers did work very, very long hours. We all did. And there was a kind of a feeling of, gosh, we're all in this together, we're in the trenches. And that was followed by a sense of maybe disillusionment and exhaustion, maybe around, say, May, June. And then finally to a recovery phase, maybe it was around the end of June, when people felt, okay, well, we coped kind of well. Some people might have experienced resentment. I think what's interesting is now is that we're kind of, are we going to go, we're back into a kind of a second wave that, you know, looking at post-recovery, after waves of difficulty like this, what is reported to be required is that people get a proper thank you. That thank you for all the extra work, for the different type of work that you were doing, for the efforts, for the support, for communicating well with your colleagues and supporting each other. And also having, telling people to make sure that they rest, that they reset the work, and then that there's monitoring and ongoing support. I could see these stages in the work that I was doing, and I did find that in communicating with the teams that I was working with and part of, reminding people of those 3 points from Professor Greenberg actually were really, really helpful. So the service I was providing and continue to provide is to provide psychological support to public health in the East, and was redeployed to do that. So this involved providing some weekly psychological support emails with 2-minute mindfulness recordings. This practice really was established in looking at seeing what would be a good way to connect with people and provide the resources. And this seemed to be the best way, and knowing that every Thursday the email was coming. Providing a psychological first aid service was saying that to everybody, you can come back, you know, ring me, and I am available if this is needed. Collation of distilled resources. Like in the beginning, it was hard to know, what is the research saying about providing psychological support to a pandemic? What is going to be the impact on healthcare workers, and how can we provide the resources? So ensuring that getting the support from the library and getting all of the resources, this really helped. Also making sure to have continued weekly meetings with the public health managers and contact with public health leads. So I conducted a survey at the end of June after sending the 10 weeks of weekly emails, and found asking people how they experienced the emails, and people found that mainly they were of value, they were supportive, and they were a good resource. Some other people did find that they didn't have time to open them, and also that others weren't aware of the service. So in terms of staff experiences, other things, people found that, as we know, the impact of COVID on healthcare workers is that people found that they were stressed. Mostly people were working long hours. I also found that people were finding that forgetting to care for themselves, that, taking the breaks, making sure that they had 2 days off together at the weekend, but found that there was so much pressure that they were almost forgetting to look after their own needs. They found that usual supports were diminished during kind of lockdowns, that it was very difficult to actually have the outlet of sport or interest, that it just that, and also contact with family and friends sometimes. I found that the small breaks, we know from the literature, small breaks help the neurobiology, in particular with mindfulness. For example, most of you will be looking at a screen now, a rectangular screen. So if you look through, you'll see that there's a short part and the long part. One small exercise, if you'd like to do with me now, is to breathe in through the short part, pause, breathe out through the long part, pause, breathe in through the short part, pause, breathe out through the long part, pause. And maybe you want to do that 2 more times yourself. So it's short exercises like this that are important to give us those little breaks, and that I found that healthcare workers found helpful. Sleep was actually a key issue. So many people said that their sleep was disrupted. That, as we know, it's restorative, and it helps function effectively. And remembering to go to bed early and not to be using the devices in terms of the phones and not having them there was something that people found helpful, and pointers on sleep. Meaning and gratitude was interesting. Obviously, there's huge impact of losses, and also then reminding us to be grateful for what we took for granted. And this was noted to me that people did experience that, and also feeling more connected and needed as part of a team. Another survey is the recent national survey of HSE staff, and looking at the wellbeing issues, there were 4 key issues that were identified as being important for healthcare workers. And this was in terms of ensuring that the working environment is safe. That is something that people did say, is there, like, if I come into work, am I at risk? Can I be sure that there isn't a lack of any supplies in terms of hand sanitizers, making sure that the environment in terms of social distancing is adhered to. The issue of isolation and working from home and social distancing has resulted in reduced daily interactions, as we know. People miss those chats at the water cooler, as they say. And the virtual coffee mornings seem to be something that can certainly help. We've heard about the concept of always on. Combining work and personal space, as we know, has led to some poor working habits, and then trying to make sure that people are taking the breaks and not working late, and also having signposts. Some people have said that they lack clarity on what supports are available, and this was actually interesting from some research that was done in Galway. People saying, yes, managers telling people that there is psychologists is available, and we're saying, where are they? They want to know where are these available resources. Flexibility has become a big issue, that the COVID has placed additional burdens on many staff, and additional flexibility in working has proved to be important for people. So in summary, really, that the impact of COVID on healthcare workers. The basic needs of healthcare workers can be forgotten, but are really important. Like, I found that ensuring that people were able to take breaks, that they were able to connect with each other, ensuring that while people are working at the weekend, if the canteen wasn't open, that food was available. Healthcare staff do, as we know, experience stress and uncertainty. So ensuring that there is that support and clarity that can help with this issue. We found that staff were working outside their roles. People did say to me things like, I'm totally out of my comfort zone, but they were flexible and found that team working was really important. Working from home, as we know, is positive, but also leads to isolation. And a key message is the importance of providing psychological support to healthcare workers to manage stress and anxiety during a pandemic. So, what should future services be like in terms of providing psychological support and looking at the impact for healthcare workers? Flexible and responsive services. I found that these points have really got from looking at the surveys and also from my experience providing the services. When staff are extremely busy, the services really need to be tailored to what staff exactly need. I found that in our case, it was in sending weekly emails, distilling information, making contact for staff. People would know the particular day that you'd be there, and building trust by keeping agreements and really showing effort in a kind of a consistent connection. Training and education is crucial. And I suppose the time now that we know what was expected, the time to do that is probably after this lockdown, and maybe continuing as well, including kind of resilience and other additional training on stress management and well-being. Access to resources. Staff would say to me that they can't have big attachments, that it's really helpful if a lot of distilled resources can be in a clear way in a link. Understanding staff needs, really being able to use the surveys, connect with people and understand the kind of self-management of stress needs that people have, and putting the supports in an easy way for them to access. We know that psychological first aid is the best evidence way of providing psychological support. And I think it would be helpful for all managers to be trained in psychological first aid. John Hopkins services, they provide some training. I think it's a 6-hour training, and there are many other areas that can provide such services. Leadership. Quite a number of staff found that they were catapulted into different areas of leadership which they wouldn't previously have had. So that in that sense they would need support on leadership, and also for the leadership to be very visible and supporting. Collaboration. I thought it was interesting that there was a stage where actually the health and well-being, mental health area was getting quite crowded, that there was a real surge of responding. So in a sense that it's important that all the elements of the organisation collaborate well and be clear about who's organising what and in what way, and that is and supporting each other. And future planning, I think this is, as we know, unprecedented. It is really crucial that we listen to what healthcare workers need, and also then implement the lessons learned. Certainly some of the key lessons were communicate, and also really remembering to take time and to breathe. Thank you very much.